Well, Pune in Maharashtra state is one of the biggest vaccine production centres in the world, but they too have been suffering a big coronavirus outbreak. Well, Sudhir Mehta is lead and coordinator of the Pune platform for COVID-19 response and president of the Maharashtra Chamber of Commerce. Thank you very much for being on the programme. Now, where you are, you've led a very coordinated response to this crisis. Talk us through what you've done and how it has helped in the fight against COVID-19.
Thank you, Sally. First of all, Pune has been at the center of the epidemic for the past 1 year. Fortunately, in Pune, we have a coordinated response where all members of civic society, the private and government hospitals in the city, the scientists, the academicians, as also the local government officials, we've been seamlessly working together for almost the last 14 months. Just to put this in perspective, we used to have a capacity of maybe 4,000 beds in the city, which has now been increased to 24,000 beds. The number of ventilators has gone from 300 to 1,400, and possibly we have the largest number of ventilators in any city in the country. And all of this has been possible because of the coordinated effort of citizens, as also the medical community, of course, supported by the government.
So you clearly illustrate there what you've been able to provide for those who are suffering from COVID-19, a huge increase in the number of beds available. Have other states in India tackled this in a similar way or not?
Well, the response in different states is of course different. India, as you know, is a large country, and of course the needs and the requirements in different states are different. Also, they are at different stages of the curve. Maharashtra was unfortunately the most impacted in the first wave and as also in the second. But I think as far as this particular state is concerned, we are now probably peaking, and we hope to start plateauing in the next couple of weeks. But the next few months for India are definitely going to be a time of great trial and tribulation, which is why we are now trying to extend our efforts nationwide. During the last 4 days, we mounted an effort supported by the Temasek Foundation in Singapore, almost 200 companies in India, the Prime Minister's office, Air India, and we are actually flying in about 4 aircrafts worth of material, 8,000 oxygen concentrators, 1,000 ventilators from Singapore, and we do believe that many such efforts will bring relief. Of course, it's going to take some time, but I think we are all at it.
And also, for example, much of our reporting is based on Delhi, where there's a real crisis right now with lack of beds available, medical help, just the people they need, nurses, doctors. It's critical at the moment there, isn't it?
Absolutely. Unfortunately, what's happened is this time the wave has simultaneously hit most cities. To give you a perspective, the requirement of oxygen has gone up by almost 600 to 800% in most cities now. And this has certainly caused a major capacity or a delivery issue. I think we're all struggling through that, and we're trying to make sure that we are able to set this right in the short term by supplementing the oxygen availability. And then, of course, on a long-term basis, we will have to look at surge planning to see how we can take care of these challenges.